You know, the U.S. healthcare system, it throws away nearly $1 trillion a year. It's a staggering problem. But what if all that waste wasn't the problem, but actually the solution? We're about to explore this incredible story of how discarded resources are being transformed into a lifeline for communities in need. Okay, let's just start with a number that's, well, it's almost impossible to really wrap your head around. $760 billion. And this isn't some budget or a wild projection, no. This is the rock-bottom estimate for what our healthcare system wastes.
And believe it or not, that's just the low end. Some estimates push that total waste all the way up to $935 billion every single year. I mean, this isn't a leak. It's a constant, staggering drain on the entire system.
So to put that into perspective, research in the Journal of the American Medical Association, JAMA, found this waste accounts for a full 25% of all healthcare spending. Think about that for a second. For every $4 spent to keep people healthy, one of those dollars is thrown directly into the trash. Just gone. Imagine what else that money could do.
So where on earth is $1 trillion in waste actually coming from? The answer is, well, it's both complex and frankly infuriating. So let's break it down.
What's really fascinating here is seeing how this waste breaks down. It's not just one thing. You can see these slices for things like overtreatment and failures in care, but look at those two giants, administrative complexity and pricing failure. Together, they make up more than half of everything. And this table really puts those numbers in sharp relief. Administrative complexity, I'm talking about the endless maze of billing and paperwork, costs over $250 billion. Then you've got pricing failure, like inflated drug costs, costing almost as much. These aren't just minor leaks, they are colossal systemic flaws.
But this story isn't just about the money. All of this financial waste creates a really deep human paradox, a world where incredible surplus exists right alongside profound scarcity. And this right here is the core contradiction. On one hand, our system has so much surplus that millions of pounds of perfectly good medical supplies are just discarded. On the other hand, you have entire communities that can't get access to even the most basic care. We have waste and want, just existing side by side. It's wild. And let's be super clear, we're not talking about expired or damaged goods here. This is high-quality, life-saving equipment. Anesthesia machines, sutures, wound care kits, all tossed out, a lot of the time for reasons as simple as a dented box or some inventory rule.
Of course, this scarcity isn't felt equally by everyone. The consequences of this disconnect fall heaviest on those who are already facing barriers to care, specifically Indigenous, migrant, and rural populations who are consistently left behind by the mainstream healthcare system.
So, okay, we've got this massive, twofold problem. Staggering financial waste, and this tragic scarcity of resources. But this is where the story shifts. Let's take a look at an innovative solution that completely reframes this entire challenge. This brings us to the core, transformative idea. The one question that changes everything. What if the problem was also the opportunity? What if all that surplus could actually solve the scarcity? And this is the whole idea behind the PAMA project. Their mission is to intercept this huge stream of waste and transform it into a source of health equity. And they do it using a model that's built on ethical redistribution and logistics that are deeply rooted in the communities they serve.
And their model is it's elegantly straightforward. It all starts with recovering those high-quality discarded supplies. But here's the key. They don't just drop them off. They deploy them ethically. They build local capacity by training health workers, and they create systems to deliver these resources equitably, making sure they get to the people who need them most.
But here's the really crucial part. How do you make sure this redistribution is actually fair and truly effective? Well, PAMA's answer was to invent an entirely new metric for care. And this is the question that separates simple charity from true solidarity, right? It's not enough to just move boxes from one place to another. How do you build a system that's genuinely ethical, one that's grounded in trust and accountability?
Their answer is called the Strategic Solidarity Index, or SSI for short. And this isn't your typical performance metric about efficiency or cost. No. This is a revolutionary framework designed to measure what actually matters in ethical care. Things like trust, transparency, and responsiveness to what the community really needs.
And this index isn't something they designed in some corporate boardroom. It's co-developed with the very people it's meant to serve. We're talking local clinicians, health workers, and patient advocates. It's built on feedback and designed to be culturally responsive. It's all about building systems with communities, not for them.
So this brings us to the ultimate goal of this entire effort, which is really a fundamental shift in how we think about access to healthcare in the first place.
So what's the ultimate takeaway here? It's that a more just and effective healthcare system isn't some impossible dream. It's achievable. And it all starts by radically rethinking what we call waste and rooting every single solution in community trust.
The ultimate goal, in Packama's own words, is a more equitable future, one defined by solidarity, not privilege. It's such a powerful vision. And it kind of leaves us with one final question. What other waste in our world is just an opportunity waiting in disguise?